protein losing enteropathy is a rare intestinal disease with some extraintestinal and intestinal protein loss, mostly intestinal. So these things are not always obvious, but patient is losing protein in the intestine, in the stool, and in the long term one can have hypoalbuminemia, hypoproteinemia, and can have edema in extreme possible circumstances. So the causes of the protein losing enteropathy are usually an infectious agents, the gut infection by cytomegalovirus, the rota, HIV, salmonella, Shigella, and common viruses, and then your parasitic infection, giardiasis, tuberculosis, and strangular tuberculosis, and so forth. Inflammatory disease like Crohn's disease, ulcerative colitis, the IBD, celiac disease, they can have also protein losing enteropathy, and you have the malignancy like lymphoma. Then neuroblastoma, they can have protein losing enteropathy. Immune disorders, the IgA vasculitis, they can have protein losing enteropathy. Good amount of time you do not have any cause. You have the idiopathic lymphatic dilatation, IL. So these cases have lymphoid mass less in the gut. They have protein loss in the gut. They have also lipid abnormalities, lymphocytic leak into the bowel lumen. So they have steatorrhea, lymphopenia, and in the long term you have decreased albumin, you have edema formation, severe cases. And the primary idiopathic or lymphangiectasis, IL, primary IL, have some genes, the vascular permeability growth factors VEGF, and the proxy FOXC2 and SRY. These are the genes which are found to be involved in the primary IL, intestinal lymphangiectasis. And treatment of those cases, diagnosis is basically the biopsy and 1 alpha hydroxylase alpha antitrypsin level in the stool, higher amount of 1 alpha antitrypsin in the stool, and the lymphoid tissue abnormality, as I said earlier, in the gut. So they have dilated lymphangiectatic channels, and you can see these things in video endoscopy also, and MR magnetic resonance in lymphangiography is said to be diagnostic. So supportive treatment and high protein diet, low fat diet, and medium chain triglyceride rich diet are said to be good for them, and treat the underlying infections, immune disorders, or the inflammatory disease like say IBD and others. And at times very small subset of cases you may benefit from your surgical resection of the localized portion of the intestine. Rarely you do need it. Few cases may respond with the propranolol, sirolimus, and everolimus, that they are not very high. So this is a newer entity, or the rare entity is to be looked upon in that way, protein losing enteropathy.